Polycystic Ovarian Syndrome, or PCOS, is a complex hormonal disorder that affects millions globally. When you present with symptoms of PCOS to your physician at your doctor's office, your doctor will probably run some blood work, do a physical exam, and an ultrasound of your ovaries. And in order to be diagnosed with PCOS, you have to meet two of the following three criteria. So number one is that you have irregular menstrual cycles, meaning that you must have had heavy periods or you could have missed your periods. Criteria number two is high levels of androgens, meaning that your insulin is really high. You're causing your ovaries to produce a lot of testosterone, leading you to have interference of your ovulation. And criteria number three is having on ultrasound, having polycystic ovaries, meaning that you have a lot of cysts and follicles in your ovaries. So you must meet two of those criteria to be diagnosed with polycystic ovarian syndrome. One of the first places that PCOS can show up is in the form of chronic inflammation and gut issues. What happens to someone who has PCOS and is extremely inflammatory is they start to have problems with digestion. They can't absorb all the food and the nutrients that they're supposed to get from the food that they're eating. And so they may start to experience things such as bloating, stomach pain. This can also manifest as weight gain, PMS issues, acne, and mood disorders. And so the gut is often referred to as the second brain, and its health is crucial for overall well-being. In PCOS, an imbalance in gut bacteria can exacerbate inflammation, leading to these symptoms that I just talked about. Managing gut health through a balanced diet, probiotics, and reducing inflammatory foods is so vital. You often hear on TikTok and social media about, different forms of PCOS. So PCOS can show up in many different ways. The first one I just talked about being inflammation and having gut issues. But another very common way PCOS can show up is through insulin resistance. Almost 70% of women with PCOS have insulin resistance. The way this can show up is that insulin resistance impairs your ovarian function, and this leads to increased androgens, increased testosterone, increased insulin, and it can manifest in an individual as having weight gain, having hair growth, hair loss, having hair growth in areas that you normally wouldn't, such as facial hair, having issues with fertility. It can show up as having mood swings. And another way that PCOS can manifest is through stress. If you're chronically stressed out, if you're addicted to stress, if you're constantly in your sympathetic fight or flight, you're going to have nervous system dysregulation, and this is going to cause you to have increased cortisol, which is your stress hormone. You're going to have increased estrogen, decreased progesterone, and this can lead to a cascade of symptoms. It can manifest as you having irregular cycles. It can manifest as you having weight gain, hair growth, mood changes. As you can see, inflammation can cause insulin resistance. Insulin resistance can cause inflammation. Stress can also lead to insulin resistance, and it can also cause you to have gut issues. They're all intertwined, and all of these, basically what they have in common is that they're all symptoms. So a lot of times when you're going to your doctor with PCOS, they mainly treat one of these symptoms. You probably went in saying, I'm having trouble losing weight. I'm having hair growth on my face, on my chin, around my nipples, and I don't know what to do. So a lot of times doctors will treat this with a medication, but all of these that I just talked about are symptoms, and it's not getting to the root of why you have PCOS symptoms. So when you look at this, at the root of all of these, it really is your metabolism, right? This PCOS is a metabolic disorder. All three of the categories of PCOS that I just discussed, such as inflammation and gut healing, All three of the categories of PCOS that I just discussed, which are inflammation, insulin resistance, and stress, all share one thing in common, and they are all impacted by your metabolism. This is why 25% of women with PCOS, the number is probably higher, have thyroid issues. So they're usually hypothyroid. Your thyroid is responsible for helping your liver store glucose and to balance your blood sugar levels. So you can see how some of the symptoms of insulin resistance, inflammation, gut problems, and stress are all related and can all manifest as each other. And because 70% of women with PCOS have insulin resistance, how do we fix this, right? What do we start to focus on so that you can start to improve these symptoms and have better blood sugar control? Well, one of the first things that women with PCOS do wrong is cutting out carbs. You need the carbs for your body to make energy and to function properly. And so you need to have a balance of your macros and a balanced nutritional plan that works for your body, which includes protein, fats, and carbohydrates. You may not need a lot of it, but you have to figure out what works for your body. Through the balance of the protein, fat, and carbs, your body is able to use not only fat as a source for energy, but it can also better utilize carbohydrates. Another thing is being able to strength train, because when you strength train, your muscles pick up the fatty acids and you're better able to utilize glucose for your body. So it's really important to get into a routine of not doing all these hard cardio workouts and taking breaks in between so that you can balance your hormones and your body can receive that break and you can utilize your glucose levels, or you can utilize glucose better so that your muscles also strengthen. Another really important thing for insulin resistance is getting adequate sleep. This is a big one. I hear from people all the time because they're so stressed out that they have issues with their sleeping habits. Some of the things that you can do to improve your sleep is to sleep in a room with blackout curtains, make it as dark as possible when you're going to sleep, cut out your screen time. This includes TV, phones, laptops, at least, if you can, 3 hours prior to bed. I know that's hard for a lot of people. So even cutting out your intake of TV and phone and laptops for an hour before bedtime really helps. If you can't do that at all, then what I would suggest is getting blue light blocking glasses and putting them on once the sun sets so that you can start to really balance out your hormones and you don't experience that surge of insulin and having problems with your glucose. Another thing that you can do is make sure that the room that you sleep in, it's been statistically proven that if you sleep in a room that is cooler, your body tends to get better sleep. And so making sure that your room is optimized with a temperature of about 65 degrees Fahrenheit. And I believe that's 18 degrees Celsius. And I know that may be cold for some, but it really helps with your sleep. And you can also take supplements to help with your sleep. Again, this is very individualized and I would talk to your healthcare provider, but what's worked for me in the past when it comes to times where I've just really stressed out is taking magnesium. Magnesium glycinate is really great for the body. It absorbs really nicely, and doing transdermal, like doing a lotion of magnesium on the bottom of my feet also really helps. And taking about 2 grams of glycine, which is an amino acid, works really, really well. And there are other supplements you can experiment with. It doesn't work for everybody, but sometimes L-theanine can also help you relax your body. And I also do a lot of breath work and meditation before going to sleep to really put me in that parasympathetic state prior to going to bed. And all of these can really, really help when it comes to improving your insulin resistance. Another thing that you can do is get adequate sunlight in the morning. The first thing when you wake up, if you can just go outside and get 10 minutes of sunlight into your eyes. That's the best way to help your circadian rhythm and balance out your hormones. These are all really easy ways to start to improve your insulin sensitivity. Let's talk about some supplements that I really love when it comes to PCOS and managing your symptoms. The first one is pretty obvious. You hear about it. It's the buzzword on social media right now, and that is magnesium. Magnesium is so vital for over 300 different enzymatic processes in our body. It literally helps to produce energy. We need it, right? And it also helps to improve insulin resistance and to manage your stress levels. And so getting a good quality magnesium supplement, I just love to use it topically. And sometimes I like to use magnesium glycinate at night, really does help with your PCOS symptoms, particularly when it comes to insulin resistance and your stress levels. And you can use the magnesium lotion. I particularly like to use it before going to bed on the bottom of my feet. That's one of my favorite ways to use magnesium. The second supplement I want to talk about is vitamin E. Vitamin E is an antioxidant. It helps to fight off oxidative stress and inflammation in the body. It helps with also balancing your hormones. There have been research studies that have shown that vitamin E has helped to increase your progesterone levels. So it's really great for women with PCOS. It's a vitamin that I really, really feel helps with metabolism and weight loss when it comes to women struggling with weight loss with PCOS. The third supplement that has been thoroughly researched over the years is the myo-inositol with the D-chiro. And this particular blend is the 40-to-1 blend, and it's been researched and it's been shown to really help with insulin sensitivity and to help balance your blood sugar levels. It's also, in my opinion, better tolerated than metformin for insulin resistance. So I really do like this one. Again, you have to be mindful that you're getting the correct blend out there, and that's the 40-to-1 blend. So you can get it, usually you can find it on your local health store, health and wellness pharmacy should carry it. There's a couple of versions of this that I really love, and one of them includes the Ovasitol. That's a really good brand of this myo-inositol that I particularly like to use with my patients with PCOS. The other supplement that I think works really well with patients with PCOS is brewer's yeast. The reason being is because brewer's yeast has a lot of chromium in it. It's a natural source of B vitamins and potassium and calcium. And you need all of these minerals for your metabolism and to really help with weight loss when it comes to PCOS. And lastly, another supplement that I really like for my patients is coenzyme Q10. And this one helps to produce energy at the cellular level. So again, it really helps to support the metabolism when you have PCOS. Again, you want to be mindful of taking supplements and really talk to your healthcare provider to see what works for you and your body. And you want to work on getting your nutrients and your food correct prior to taking any other supplements. But supplements can really help support your journey on weight loss or helping with any of your other symptoms that you're going through with PCOS. You guys know me, and I love to help my patients with any symptom or any condition that they come to me with through a holistic approach. And through the Ayurvedic standpoint, when you view PCOS, they view this as an imbalance in two particular doshas, which is the kapha and the vata. And to help somebody with PCOS, you want to balance these doshas through lifestyle changes, your diet, and herbal remedies. So in Ayurveda, they prescribe different yoga and breathwork techniques, which I usually do with all my patients, to really help the condition that you're teaching. When it comes to PCOS, some different forms of yoga, such as the butterfly pose, the boat pose, and the cobra pose, really help to increase the blood flow to the reproductive organs and open up the hips so that you can start to experience less pain in that area, less inflammation, and just overall a sense of balance throughout your entire body. And some breath work that's really powerful for somebody who has PCOS is going to be alternate nostril breathing, or doing Kapalbhati, which is breathing in and out forcefully through your nose. The reason these techniques are so powerful is because they help to balance your nervous system, which then balances your hormones and decreases your stress. And so you also have an overall sense of well-being and vitality and a balanced prana going throughout, prana meaning life force going throughout your body. PCOS may be a hidden epidemic, but it doesn't have to control your life. By understanding its root causes and addressing them with a holistic approach, you can manage your symptoms and reclaim your health. Thank you for joining me on this episode of Beyond Symptoms. If you found this episode to be helpful, make sure to subscribe and share it with somebody else who you feel might benefit. Until next time, take care of your health, and I will see you on the next episode. Thank you. Bye.